Welcome back to Against the Grain. My name is Dr. Samir Kakodkar. I'm a gastroenterologist and specialist in ulcerative colitis and Crohn's disease. Thanks to everyone around the world who's listening to this podcast. I really appreciate it. Please do subscribe, hit follow at the Podomatic website or through iTunes subscribe so I can continue doing this. You can reach me at samir3@gmail.com. Jini Patel Thompson is an internationally recognized expert on natural healing for digestive diseases. She says she has healed herself from widespread Crohn's disease and has maintained drug and surgery-free remission for over 20 years. Jini has appeared on numerous television and radio shows throughout the U.S. Her books on natural healing for digestive diseases have sold worldwide in over 80 countries. We had an epic, almost 2-hour conversation about her methods to treat Crohn's and colitis. We talked about the limitations of conventional medicine, her treatment protocols, Mycobacterium avium paratuberculosis, the dogma of diets, tricks to make exclusive enteral nutrition more palatable, electromagnetic radiation, 5G, amongst other topics that most conventional doctors would think of as out there, but I'm not afraid to delve into. As a caveat, this is not an endorsement or recommendation of any of the so-called natural methods discussed on this podcast, as they have not been FDA approved as treatments for Crohn's or colitis. You should discuss any complementary or alternative treatments with your treating physicians. Thank you so much for being on the show. I know you have a very busy schedule, and I know it's tough to find time in the evening to do these, but my understanding is you've done quite a few of these podcasts and other shows, and I see a lot of videos of yours that are online.
Yes, I mean, I've been doing this for over 20 years, so there's a backlog of content there for sure.
So before we get started, I just wanted to give you and the audience a little bit of context regarding, why I'm familiar with you and why we're having you on as a guest. Several years ago, probably close to 10 years ago, I read your book, the Listen to Your Gut book, and experimented with some of the protocols back then. And the book was very thought-provoking for me. It was actually the first place I heard about the theory that a bacteria called MAP, or Mycobacterium avium paratuberculosis, may be a causal factor in Crohn's disease. Like, your book was the first place I ever saw that, and that kind of led me down this rabbit hole of reading about that a lot. So thank you for that. And I know you made an appearance on Reed Kimball's documentary, Crohn's End, and Reed has been a guest on this podcast before too. Mm-hmm. So in preparation for this interview, I watched one of your YouTube videos titled 8 Key Steps for Natural Healing of Crohn's.
No, the long one, the monster video.
Right. I think it's like an hour and a half. I watched the whole thing, and I jotted down some questions for you. So I appreciate your perspective and insights with your own personal diagnosis of Crohn's and also working with people with various GI disorders. I agree with you on some things, and I think we'll likely agree to disagree on others. But that's okay. This is an open forum. That's the purpose of this podcast, is for people to be able to express their opinions and trying to look for new ideas with regard to treating this disease. So again, thank you so much. Can you give us a brief history of your Crohn's diagnosis and what conventional treatments that you tried before going kind of this alternative medicine route?
Right. I was diagnosed. My gastroenterologist headed up a national research team in Canada at the University of Alberta. And so he had already diagnosed my brother 2 years previously. So he was, my father's a doctor and my whole family are doctors and pharmacists. They were like, we're getting you into the best guy. So he diagnosed me with Crohn's in small and large intestine. By the time I left the medical treatment protocols 3 years later, they strongly suspected it had spread to my stomach, and they were insisting I have surgery and more scopes and things like that. So at that time, there was no Humira, Remicade, any of these, crazy strong drugs. There was prednisone and cilazopirin, Asacol. Those were more the standards, and I was on all of those, along with, occasionally Imodium for diarrhea and, lesser drugs for this and that. So because I came from a family of doctors and pharmacists, I had no knowledge of alternative or herbal healthcare. I thought it was for poor people who couldn't afford medicine. So that's how far I did not even question. I just did everything that they said and had all the exploratory tests done and took all the drugs, and then just nothing was working, and I was getting sicker and sicker. And he was very straightforward with me. He said, because, you have such a severe case, he said, you are, it's incurable. You're going to be in and out of the hospital the rest of your life. You won't be able to have children. You won't be able to hold a job. And they even said you won't be able to probably finish this year of university. And they said, but, at least you'll qualify for disability insurance, so you don't have to worry about the financial aspect, like how are you going to live when you can't work or go to school or anything. And I was just like, wow, that's seriously crappy.
That's interesting that he said that. And I remember watching that on the YouTube video, that he termed it that way, that he said that definitely people can have severe disease that can affect as far as what they do. But as far as how gastroenterologists are trained, and I can tell you from the other side of the curtain, we are supposed to tell inflammatory bowel disease patients that you're going to live a normal life. You're going to be able to have children, have a normal family life, accomplish whatever you want to do. And so it's, I know we're kind of talking in a different era, because around this time, this was like the 80s, right?
Yeah, this was 34 years ago.
Okay.
So don't forget, the internet did not even exist.
Right.
And they knew virtually nothing about IBD at this time. So what he was speaking from was to say, listen, I guess the way they were looking at it was, if we tell you the truth and we give you the prognosis, you can plan better, right? And then you won't have these unrealistic expectations and thinking that, I'll just continue my university degree and then be really upset and just beating yourself up all the time because you can't actually do anything.
Sure.
So there was no malice or anything when he said that. Like, he was just saying, like, based on my experience, for someone with a case at yours, at your degree of severity, this is what it's going to look like.
Okay.
So just kind of, and also I think the fact that my father was a doctor, and, doctors talk a little bit differently to other doctors than they do to, straight lay people. So, and I wasn't offended at all. Like, people go, oh my God, that was horrible. And I was like, no, he was just being a realist. And I was totally grateful to him for that, because that was a big part of the motivation that, as time went on, and I was just getting sicker and sicker and more, I couldn't do anything. I couldn't go to a movie. I couldn't have dinner. I couldn't, nothing.
Sure.
So that's part of what made me think, you know what, I'm going to heal this, or I'm going to die trying, because I'm not living like this.
I wanted to ask a few details about your particular diagnosis, just so the listeners can get a sense as far as what you subsequently tried, kind of what the phenotype of that disease was, and if, did you have any stricturing going on in the small intestine or in the stomach, like any strictures or fistulas or penetrating disease, like abscesses? Was any of this stuff going on, or was it like a purely inflammatory type of disease?
It was mostly inflammatory with active ulceration, and then there was a severe stricture in the large intestine.
Okay.
They couldn't actually get the scope past that point. It was so narrowed.
Okay.
But no fistulizing, thank goodness.
And I think, probably your GI with making those remarks may have been influenced just by, you're right, like back then, there wasn't much available as far as medical treatments, or even knowing the pathophysiology of why it might happen, what may be the contributing factors. So certainly the attitude may have been different than it is now, as far as how we discuss it.
Back then, cancer was a death sentence, signed, sealed, and delivered, right? So things have really, you have to think of how fast our world changes nowadays. right? Like even like we're not even in 5-year increments. We're in like 1 or 2 year increments, and something comes along and just changes the face of how something is viewed or done or moved through. And, I think time is really speeding up.
Right. No, absolutely. That's the hope. There's a lot of, the one that comes to mind now, as far as recently, the medical breakthrough is treatment of hepatitis C. I mean, they're curing hepatitis C with medications now. And, the hope is in the IBD community that's going to come about by some medicine. I don't have high hopes for that, like a medication bringing about a cure for IBD. And I think you probably are in agreement with that. It's probably going to be a combination of things. But I wanted to ask you, can you explain what your opinion is regarding the conventional approach of treating ulcerative colitis and Crohn's disease by medical doctors? And because I know you've understandably lost confidence in based on how you were treated back then, and you've lost confidence in doctors and medications. Can you go a little bit into that?
I think my main reasons that I don't support or recommend medical treatment is, number one, the collateral damage, otherwise known as side effects. And for the model of healing that led to me being completely healed for, decades. And, I travel, I can go anywhere in the world. I can eat anything I want. I'm healed. So that system of healing is holistic. And so to say, well, I'm going to take a drug that suppresses a symptom, meanwhile, knocking out my adrenal, suppressing, thyroid function, or, the whole cascade of drug collateral damage that's caused doesn't fit with the model that I have had the success with. So that's not to say that drugs are not useful as short-term measures. Like the body can get in a feedback loop, and then a drug which stops, it just kind of cuts it and gives the body a chance to go, oh, wait, what? Oh, reset, or like a short-term crutch. I have readers who contact me and they're like, I'm in my final semester of college. I want to do your program, and I'm like, a final semester of college, take the drugs, pass, get your degree, then heal yourself. So there is definitely a place where I see drugs, being useful for people. But in terms of healing, I don't find, for my model and what worked for me, I guess the only exception that I would make to that would be if you're doing what Thomas Borody did at Sydney University, and he was using, very potent antifungal, antibacterial drugs to wipe out all the pathogens. And then at that time, he was repopulating with a combination of high dose probiotic retention enemas and then his fecal implant procedure. So that, okay, because then you're going in there and you're doing a lot of damage, but then you're kind of coming right on the heels of it with what the body needs to function and stay healthy in its natural state. So that a treatment like that certainly has some value for me. And then, but again, I would come in and I would say, well, the antibiotics, look at the tendon rupture. This is, again, we're looking at systemic collateral damage that can be caused by drug antibiotics, that there are a number of powerful herbal natural antibiotics that don't cause the side effects.
Right.
So again, I would say, well, why, So,
yeah, so, I totally get where you're coming from when it comes to side effects of medications. I've experienced many of them related to multiple medications used for IBD, so I get it. I understand. But I think one thing to just keep in mind when talking about these is, there is also collateral damage to not treating the disease. And I understand you have your natural protocols, but leaving inflammation unchecked, uncontrolled, can lead to downstream effects like developing colon cancer if you have ulcerative colitis, or developing these strictures or fistulas in Crohn's disease that, maybe if you got to it much sooner, and, we can disagree as far as what that combination of things may be. But, and as far as the side effects of the medications, like you mentioned, tendon rupture with antibiotics. No, my mentor who I did my, training with, he's treated IBD patients for years, like since I think the early 80s as well, maybe the late 70s. And has been mainly doing IBD. And I remember asking him once, because we prescribed antibiotics pretty frequently for people with, pouchitis or perianal Crohn's disease. And I asked him, like, how often have you seen like tendon rupture with Cipro? And that's usually the one that's associated with it. And he said he's seen it once. Think of like all the patients he's seen since then. So there are risks. And these medicines are not approved unless these risks are relatively rare, especially the serious ones. And, with these biologics, it can be scary, right? I mean, you look at the commercials for Humira and Remicade, there are more Humira nowadays, and it talks about this risk of lymphoma, which for a while was disproven as far as like the recent data, as far as there being an association with lymphoma, but there was a recent study that still showed there may be a tiny risk of it. But it's all about keeping these risks and benefits in context, because the risk of getting lymphoma from something like Humira is on the order of, perhaps 3 or 4 in 10,000. And then if you think about all the things you do, other things you do in life, like drive a car, and how much more risky that is than being on that medicine. But, it's still possible, right? So that's terrifying that, you could get a lymphoma from the medication, and that's psychologically very disturbing. So I understand that.
Well, I think the other, because my other answer to your question would be look at the psychological, because, it's the placebo effect is the strongest healing mechanism that we know of, right? In any trial of any substance almost. So from that point of view, we go, well, whatever you believe is most likely to help you. You're marshaling all of your inner healing resources and your mental and your psychological and your emotional healing mechanisms behind that treatment. So, it's the same thing of when women are birthing, where should you birth? Like, you can look at the stats for the safety of home birth versus hospital birth, but what really is the determinant when you come down to it is where, as the birthing woman, where do you feel safe? And if you feel safe in the hospital, then you should birth in the hospital, right? And if you feel safe, if you have like my parents have a very strong belief in drugs. I never try to talk them out of taking their drugs, because I'm like, well, whatever you can marshal your belief behind, you are, activating the healing potential of your own body. And I don't think there's anything more powerful than that. Mm-hmm. So, I think that's where everybody's got to go. This is where I feel comfortable. This is where my belief is. This is where I feel good. Mm-hmm. And so that's probably where you're going to see your results as well. Sure.
No, yeah, I definitely agree with the power of the placebo effect and also the power of the nocebo effect, which is, I do see a lot of patients who are terrified of these medications and still kind of reluctantly decide to go on them, despite knowing, all the data behind how rare these risks are. And because you have that feeling like, oh, I'm getting this medication, I don't want to be on this medication, eventually I'm going to get off of it, this is a poison for my body, those patients tend to have more issues with it. And it's unclear if it's really related to the medicine, or maybe it's your own body, just that, that gut feeling that, oh, I don't want to be on medications, and there's some sort of physiology going on there that's, rejecting your ability to tolerate it. Because there are these kind of non-specific intolerances to these medications that don't really have a mechanistic basis, but still happen. And I think even with natural therapies, it just psychologically, you're more comfortable with doing them, and that placebo effect can occur even if it does have a scientific basis of why it may work. But the thing about placebo effects, at least according to my reading, is that usually they more help with subjective symptoms. not necessarily something like healing the colon. That you really need to. There should be, again, a mechanistic basis or something really going on. But stuff like pain or just symptoms in general may improve, especially if you're heavily invested in a particular intervention, and you feel like it's going to work, it's going to be safe, and it's going to help you. People definitely do respond to that. Mm-hmm. So, can you tell us, what listen to your gut means, and how you started your company kind of around, and it's called the same thing, right? Your company is Listen to Your Gut Enterprises, mm-hmm. right? Can you explain kind of like what that terminology means, listen to your gut, and how that all got started?
Well, listen to your gut is basically directing people to their own body wisdom and to develop and utilize their own intuition. And so for gut diseases, we want to listen to the whole body, but we really want to listen to our gut because that's where we're having a lot of our issues. So, in the book, I have a section on dialoguing with the gut, dialoguing with the body, and using that way of, feeling into, well, your brain might think this is really great, but what does your body think? And taking it into the vast reservoir of wisdom that exists within the body itself. And this was before we knew about the brain-gut axis and that, there's more neurotransmitters in the gut than the brain, and, all the science behind it of just saying there's a tremendous wisdom in the body. And what if we go there? What if we let that direct our course of action, or how much do we take and when do we take it? And then when do we need to switch to that? And, I think there's no better authority over your healing than your own body's wisdom. Mm-hmm. So that's sort of what the basis of the book is to say, look, healing is this very tangled, multi-layered, multifactorial pathway. And the best person to untangle those threads and walk those various pathways and know all the contributing factors and what needs to be done and when, because, when you have something severe like Crohn's, which is multisystemic, if you try and heal everything at once, you're going to throw yourself into a flare because it's too much stress on a body that's already, hanging on by its fingertips, right? So that becomes, again, a thing of you connecting with your body and saying, okay, well, how about this? And what do you feel about that? And how about the dosage of that? And, a lot of people use biokinesiology for that. I'm not a huge fan of biokinesiology. I think there's a lot of tester energy that gets in the feedback loop there. But, I feel that if people focus on developing their own intuition, which is just a very intimate dialogue with your own body, and that's something you can test yourself, right? You put your hand, and again, not asking when people usually ask about, well, what food should I eat, or should I eat this food, or should I eat that food? They're actually not asking their gut, they're asking their taste buds. They're asking something in their brain, and to pull it like, well, no, put your hand on your abdomen and ask there. Say, what do you want? Do you want this? Because there's thresholds with things too, right? Sometimes the body's okay with a food 3 times a week, but not 4 or 5, right? So when we're drilling down into the sensitivities of our own body, if we can get that dialogue active and intuition, I often say to people, it's like a muscle. It's the more you use it, the stronger it gets. Mm-hmm. So then it becomes easier and the voice gets louder and easier to hear. In the beginning, it may be this tiny, faint little notion of this, and you're like, and it's like, no, just act. Just start acting. Mm-hmm. Show your body that you're listening. Show your body that you're willing to act on that tiniest hint of a nudge that you maybe and maybe did not feel. Just go ahead and act. And then you'll know very quickly whether you were correct or not. Mm-hmm. But you're showing your body, look, I'm showing up. I'm willing to enter into this relationship. I'm willing to develop this dialogue. And that, I think, is where all of these healing tools can really be used to their maximum potential.
Mm-hmm. Yeah, just to play, understand that perspective. It makes sense that you want to kind of get into a deeper level of yourself and try to be in tune with your body and find out, what things help and what don't. Just to play devil's advocate, particularly in the context of Crohn's and colitis, it can be confusing because we know that symptoms don't correlate well with inflammation, particularly in Crohn's disease. And I can see certain scenarios, and I've seen patients like this who are almost too in tune with their body to the point where either they've now been on extremely restrictive diets where they're only eating like 3 or 4 things, or like rail thin, and these are people who have no active inflammation. Perhaps they're on medical therapy and they feel like they don't tolerate things, or they put themselves on a gluten-free diet and they don't have evidence of celiac disease, and as a result get like nutritional deficiencies. And so I think it can go to the other extreme as well. I definitely think people should avoid triggers that make you feel bad, but if you get too sensitive to what everything is doing to you, your life will become that, and then you'll start to lose focus as far as what you used to do and how you used to live life, and now it's just you're an antenna trying to sense everything that's going on.
And I would say that that's where you've swung out of intuition and into fear, or into dogma. Right? Because people get resilious about their food choices, right? It's you look at a lot of people who eat a vegan diet. Veganism is more of a religion than a dietary choice, and because all of the hallmarks of fundamental Christianity or Islam are present in veganism. So you have to go, okay, now we've gone into a different zone here. This is not about listening to your body's wisdom and dialing into, your stomach or your intestines. This is your mind and your fear-based and your philosophical or religious conceptual framework that you put together around, good and bad diet. And you hear a lot of words like pure and clean. Well, now you're into religion. That's a good tip off that you've kind of gone off of actual food and gone into philosophy and whatnot. So totally, I agree with that. I had a woman, this was one of the products that I formulated is for an elemental diet product called Absorb Plus. And in the early days, there was only one version of it. And I initially, in my book, The IBD Remission Diet, I just told people how to make up their own shakes, because nothing existed at that time that had, what I considered to be healthy ingredients, because the pharmaceutical versions all had massive amounts of corn oil and sugar. And, I made my healthy husband drink one, and he was spasming on the toilet within 20 minutes. And I said, can you believe they give this to people who are already having 20 bowel movements a day? Like, it was insane to me. So in the book, I said, okay, here's what you do. You order in all these products and you mix them up, and those are your shakes. And then, of course, people were like, can you just produce this for us? And we can just order it ready to go in a tub, and we just scoop it out. So that's how I got into health product formulation, because people were asking for it. So the first version was out, and it was only sweetened with fructose at the time. So a woman she was like severe malnutrition, and she was doing some kind of Sedona method therapy. And she had got this idea in her head that she just could not have any sugars at all. And it didn't matter, like you said to her, but that all carbohydrates break down to sugars, like monosaccharides. That's the end. Like, you can present her with the science, and you can say, when you're malnourished, if you just take protein, you're not going to gain weight like the body needs to have the carbs. And she just, because of her, and again, when you get someone who's in a state of malnutrition, their brain is no longer functioning properly. So here she could have gone on this elemental diet. Like, we've had people go on the elemental diet who the doctors told them to make out their will. Like, they're in the hospital, they're on the death ward, right? And they get on this because when you can build your body back up, the body's then self-healing mechanisms can start to kick in. But when you're so malnourished, Your body has nothing to pull from for its own healing mechanism. And so that's where she was. And she refused. Her friends were trying to get her to take it. And then the next thing we heard from one of her friends that she had died. So that is how extreme the psychology of, making certain foods evil or dangerous or unclean or whatever. Yeah, it can have very severe consequences.
Mm-hmm. Yeah, I think when tackling IBD, it's definitely not good to be dogmatic and whatever you're doing. And that goes along with your approach, right? Like if something works for you, it works for you. It may not work for somebody else, but that's what matters, right? And so I do find people that I talk to are trying things just because theoretically they're supposed to help, but they're clearly not helping them and maybe making them worse. But because they read some article on the internet that says, this particular food is bad for your overall health or something, they'll avoid it even though maybe they tolerate it and they want to eat it. So like these types of things that you just have to realize every person is an individual, and you have to be flexible. And the same thing goes with, there are certain diets that a lot of people can get really dogmatic about too, and they'll continue to follow it even though they just may end up getting sicker and sicker and not adjust it or maybe change to another diet. And that's a common scenario too.
And not recognizing that, a diet can work for a time and then you need to change. Like this is why, veganism, I think, becomes so popular with people, because when someone who's, consuming and probably a lot of factory farmed meat, switches to a vegan diet, they feel amazing. Mm-hmm. Of course they're going to. But what are the long-term implications of never getting the correct form of B12? That's huge. So there's things that can feel good for a time and the body needs for a time, but then the body needs other things. And if we get locked into, this is what I'm doing because this is what worked the best, but that's not how the whole of nature and life works. Nothing is static. Everything's in a cycle, right? Everything is moving continually. Mm-hmm.
So, when you've tested your protocols on other people, and from the video I watched of yours, it seems like a lot of your protocols were kind of developed based, first of all, if they worked on you tested it on yourself, and then you kind of would expand from there and test it in other people. Can you explain how that worked as far as testing other people? Like, was it through the form of, did you have like an email list or like a forum that you were telling people, hey, try this, and got their responses, or in what form was this kind of like data collected?
Well, in the beginning, there was only bulletin boards, and then there was email. Okay. So that's the first form it took, was just email, mostly email contact back and forth. And then as, of course, all the technology evolved, so for the latest protocols like the Stricture Heal, we have a form and we use SurveyMonkey, and then, that collates all the data, and then we publish that and we make the data available to people for download. So as we've had better ways, but, like anything, the compliance, people come back and they go, well, I did this, but I didn't do that. And then I did this, but then I changed that. And I did this, but then this one thing, I didn't get the brand you recommended. So it's, anybody who's done any kind of clinical trial understands how difficult patient compliance is. Mm-hmm. And this is like difficult times 10, because there's no, it's not like you're even checking in with someone every day, or, it's really self-directed. So right. People, almost nobody does the protocol the way you lay it out.
Right.
They are all modifying it or changing it in some way. Mm-hmm. So we just go, okay, well, that is what it is, and let's just see, But what the fascinating thing for me, like with Stricture Heal, using DMSO and potassium iodide and colloidal silver, and DMSO is super potent substance, so I was really concerned as to how that would go and how people would use it, and how many, like, what would the adverse effects be. But even for people who, in their survey, their response was, yeah, it didn't really work for me. In terms of would you recommend this for others, almost every single person said they'd recommend it to other people. So there's very puzzling things like that where you're like, okay, but it didn't really work that well for you. So why would you recommend it to somebody else? Strange things like that happen. That you just can't account for. It's just people, right?
Could that just be, I'm not familiar with this stricture here. I'd like to hear more about it, because really that's if you have a way to treat fibrotic strictures, meaning they don't have much of an inflammatory component, they're causing obstructions, they're causing dilation of the bowel, these long-standing strictures, as far as conventional medicine, the ways we know how to treat those, they don't respond to any of our medications. These people require sometimes endoscopic dilation, which doesn't tend to have good long-term outcomes, versus doing surgery, either kind of splitting them open, like called a stricturoplasty, or cutting it out.
Yeah.
So, because if you actually have a way to treat fibrotic strictures, that's like the holy grail of IBD treatment. So I'd be curious to hear more information about this stricture protocol that you have.
Do you want to hear about it now, or you want to just go look it up on the blog after?
I can do that. Yeah, if we want to.
Whichever way you want. I'll just tell you how I came to it.
Okay.
Again, it was from my own needs. So back when I was under medical treatment, I had these perianal skin tags. And so the doctor said, well, the procedure to biopsy them is the same as if we just remove them. And if we biopsy them and they are, cancerous, then we're going to have to go back in and remove them anyway. So I was like, okay, sure, fine, just take them out. Well, that left me with scar tissue, rectal scar tissue. And then I think from, oh my gosh, I don't know how many years of severe diarrhea, that probably resulted in some more scar tissue. So now I'm at the point where I have no symptoms of IBD, and I'm, healed and for whatever other markers you want to have, but I have structural problems from the scar tissue left behind. So I am now to the point where, because I had diarrhea for so long and the, double buildup of scar tissue, I can pass a stool the width of a pencil. Right? Now, when your bowels are loose, that's not a problem. But when you heal and then you move to one bowel movement a day, all of a sudden that becomes excruciating. It becomes a big problem. So what do? Do you actively degrade your GI tract so you can have loose stools again? Or do you go? So I went through 2 years of literal hell. Going, okay. And I looked at all the research for, the cutting and stretching procedures. And it's interesting the difference when you look at the research in North America and you look at the research in the UK. I find the UK research a lot more, I guess reliable is what I'd say. They also tend to take a longer term look at things. And so I looked at long-term 10, 15, 20-year outcomes of people who, either had themselves cut or stretched. And I was like, okay, that's not even worth it. So then I was like, okay, what can we do? So then I go into, how I do, the space of, okay, let's start looking, let's start researching, let's start testing. And a long pathway, like over 2 years, came to me developing this formula, and I would insert it into my rectum, staying upside down. Like, you can either go down into the hemorrhoid position, or you can actually go into a yoga, kind of like a modified shoulder stand, and leaving it in there for 5 minutes at a time. And I widened that to, the width of a pencil to the width of my thumb. And then I could have kept going, but then I had no motivation because, and DMSO makes you stinky. So I was like, oh, that's wide enough for me. I'll just leave that there. But, obviously to have that kind of improvement and have it last long term, that's when I said, okay, well, I'll throw this out to people and let's see how it works. And then, of course, I start thinking, well, wait a minute. If it can dissolve or somehow soften the scar tissue in the rectum, why not in the intestines? Because like you said, that's the thing where that's the big problem.
Right.
The biggest problem, right?
Right.
And so then I developed, again, just feeling into it, I went in, okay, so let's do this. So I developed an oral protocol. It's actually oral combined with topical. So you're drinking a solution, but you're also doing the topical application on the area where you have the stricture or any pain or anything. And so I tested that on myself for, I think I did 2 or 3 weeks, just to see if there was any negative effect that came up, because I didn't have anything. I didn't have an intestinal stricture to test it on, but I just wanted to see, is there a negative consequence, and nothing. And then I started giving it out to close friends, and I had a close friend who was a medical doctor, and I gave it to him to test, and he was actually scheduled for surgery on to remove a strictured piece. And so he was like, oh, I really don't want to go have another surgery. So yeah, I'll do it. So he did it. And when he went in for his pre-surgery colonoscopy, they found nothing. And not only did they find no stricture, but they found they biopsied and there was like no evidence of Crohn's. So we were like, what the what? And then he's like, I'm lying on the table and I'm like, I'm not saying nothing, because, medical system, you don't want to be like, I did this experimental herbal thing and,
right.
Not going to happen. And so he's been clear ever since then. So I was like, okay, well, let's throw it out to some more people, and just like with a ton of warnings and, this is super, super experimental and here's the dangers. And, everybody, again, you really got to dial into your own body when you test it and see what happens.
That's very, very interesting anecdote.
Exactly. And we don't have, I'm working on the 3rd edition of Listen to Your Gut. That's not going in there because it's completely anecdotal. We don't have enough, like when we did the survey of, 500 people downloaded the protocol. And then I think we had about 200 and maybe 50 or 60 responses. But again, because everybody's changing everything and everyone's having this wide variety of responses, there's nothing solid. Like with my wild oregano oil protocol, that's solid. I can put that in my book. I know that works. I know it works well. But with this, it's just too, and I think because it's a difficult protocol to implement, so that makes people change it.
Yeah.
Or not stick with it, or, do weird things with it.
Yeah, I'm trying to think, how that potentially could have happened, unless the stricture may have, there are strictures that are inflammatory, and sometimes it can be difficult to tell the difference between an inflammatory stricture and a fibrostenotic one. The fibrostenotic one being the one that you can't really treat medically. One of the clues is obviously if you have obstructions, and then they do a scan and you have dilation of the bowel upstream from the stricture, because if there's dilation, that means that stricture has been there for a long time and is likely fibrostenotic. And then they also look at different aspects of the imaging. Are there signs of inflammation? And then endoscopically, if the stricture can look inflamed, or it can just look like a bland stricture. So those are kind of the clues. I'm wondering maybe if this particular, I'm sure it's not even worth speculating, but it's possible maybe it had an inflammatory component that did respond to it. But if you're saying the scope showed the stricture disappeared, that is unbelievable, to be honest, in my experience. But hey, anything's possible. You can't
say that the patient was an unreliable reporter because he's a medical doctor.
No, right.
So it's like, oh, okay, well, that's what made me throw it out there to people.
Yeah.
Right. Go, okay, that's enough for me to go, okay, test this.
Right.
See what it does for you. See how it works for you.
Okay. Well, hopefully, after this podcast, we can, keep in touch. And if there's any of these protocols, I'll have to look into it a little bit more. But if you want to actually test these in the form of a randomized controlled trial, I have the capability to make that happen. And, you would obviously be first author on the paper. It's your protocols, but I'll implement them as long as I'll have to look into them and make sure the risk profile is acceptable, because that does have to go through an IRB and stuff. But it'd be interesting to put these to the test.
Well, and I don't think it will be, because DMSO a drug company owns the patent on DMSO for interstitial cystitis use only.
Okay.
And otherwise, you are not allowed. You have to sell it it has to be labeled for use as a solvent only. You cannot mix it. So there's no way it's going to be dead in the water right there.
Okay.
Yeah, this is what I mean, right? That's why we're forced to kind of work in this totally, which in a way is fine, right? If there's nothing wrong with being, maverick and off the wall, right? And the people who, and for someone to implement the protocols, because natural healing is always way more work than, taking some pills, right? So for someone to be willing to take the time to implement the protocol, they've got to be really self-educated and invested and have some self-discipline and all of those types of things as well. And they tend to be, my readers tend to be super self-educated. I have a lot of MDs and PhDs who go through my program, but they can't tell anyone. They can't, because that's against medical, going against your medical association. So you can't really recommend it to anybody, but they put their family members on it. So it's just this thing of and I'm totally fine for it to stay kind of under the radar as well. Mm-hmm. There's just so much bureaucracy and red tape, and then you don't want anybody with a vested interest in making a lot of money from these diseases to understand what you're doing. So that's why for anything experimental, like the protocols on my blog, they're all free. Mm-hmm. You just download the PDF for free and go for it.
Yeah, and myself, I've been somebody who's done some crazy things, and I'm a specialist in IBD, and I think a lot of my experiences have influenced kind of what I recommend nowadays. But certainly I've done things, and even to this day, I do some things that are the same way you did. Like you act as your own you experiment on yourself and see how things may work. And I feel like most IBD patients do that. I remember so many times trying some, supplement or some, hearing on some forum, somebody tried this and it worked. And then you think, maybe this will be the key for me. This one thing is going to help me. In my experience, more often than not, that has not been the case. But yeah, you always, and then I don't know if this has ever happened to you. I remember recently I had traveled I was in London, and I was eating at like an Asian restaurant, and I got the fruit plate. I usually order a fruit plate for dessert, and it came with the fruit that I had never eaten before. And anytime I eat something that I've never eaten before, it's always in my mind, is this going to cure my disease? Maybe this, that thought always comes to my mind. This is like completely new food. Maybe this has some quality to it that's going to
eternal. Yeah, exactly.
Yeah, it was passion fruit, by the way. I'd never had that before. And it was really good. But again, it's never been the case. I've never heard of anybody who's eaten like some random fruit and then all of a sudden, although I did hear a news story, this was a few years back, of somebody who was like eating bark off of trees and found a particular tree that they were convinced that had cured their Crohn's disease. And I was trying to get that person on this podcast, but I could not find the contact information.
Yeah. So
maybe that's the exception. So,
but look at pycnogenol, right? Pine bark extract is, that's one of the things I have people put in their shakes or take as a supplement during the day. And then pinon pine sap is really, that's a very powerful substance as well. So, but again, when people go, I want to do this substance or this diet or this whatever and heal myself, my experience, which is, all I can speak from, is that, okay, so let's say you had IBD and your causation was a singular event, like, you went to some third world country and picked up a pathogen or a parasite and it went undetected. And so you're looking at one pathogen equals one disease equals one cure, fine. But from what I know, most people with serious colitis or Crohn's, there's not just one thing that created this state of dis-ease or unease or imbalance in the body, right? And so to heal it, it's going to take a whole bunch of things. And especially once it's gone on for any length of time and it's settled into the various systems of the body, like you can't have anybody who's had Crohn's for more than a year who's not going to have hormonal imbalance, right? And hormones are crucial to health. So there's a whole bunch of things that need to be addressed and balanced and healed at the same time. And then there's the psychological, emotional, spiritual component.
Sure. So, yeah, and I do want to get into that a little bit later because that's also something very, very fascinating for me. Is that, you know, you said in your video, like the body is the subconscious, right? I really like that quote that you had, and I think it's valuable to try to get to the roots of maybe the psychological contributors to at least exacerbation of disease. I think it's a little bit controversial if that's like one of the causes, but still, it's always valuable to get a kind of those blockages in or these prior traumas in your life and trying to resolve them. And I've definitely heard of individual cases of people who've done that and have done a lot better in their disease. Like they finally saw a therapist and kind of talked through things and kind of got a perspective on their life and made some changes. You know, I have a friend who has IBD, and you know, he ended up, he was in a very stressful job, a lot of traveling, and was previously on medications. And then he saw a therapist and just kind of talked out things and realized that a career change was what he needed to do. And eventually did that. And he's been off of medications for years now. I mean, I think he has like relatively mild disease, but didn't require medications. Now, I don't know how common that kind of response would be. In my clinical experience, he's the only example of that I've seen. But still, I think for everyone it's helpful to have better mental health, especially with these diseases.
Definitely. And then you have the quote IBD personality, right? Where of the type A and the achievement oriented person. Have you seen the data on that of the personality type of people who get IBD and IBS? Yeah. And so my question too is, but was that a pre-existing personality or result of what living with this kind of disease does to you? You know, so you're in a chicken and egg thing, but regardless of that, now you have anybody who has to get through life with this level of physical malfunction is going to be very stressed and start to get very fearful and start to, you know, like there's a whole bunch of psychological, emotional things that occur as a result of what's happened to your physical body. Right. Not even, you know, maybe your originating personality or your originating energy field or whatever. It's like now this has all happened afterwards. Right. But it's still not healthy. It doesn't lead to health and wholeness and relaxation.
Sure. Yeah, I am aware of this concept that, you know, type A personalities may be more predisposed to IBD, but I think that's subsequently been debunked. And in my clinical experience, I see the whole spectrum of types of personalities who get IBD. There's certainly those who are, you know, very high achievers who are very, you know, up on their disease and keep on top of it and want to know everything about it and tend to be like relatively intense. But then there's definitely, I've seen plenty of people who are very laid back. They come to the doctor, they may or may not follow instructions or know hardly anything about their disease. And so it for me, at least from what I've seen, is that I don't see a consistent thing where like everyone who's coming to see me is these like very high achieving, intense people. But I mean, those are the ones that kind of stand out, though. You know, like when you go online, and like those are the ones who are posting, so you can get kind of like a biased sample. So let me look at my next question. So a lot of things makes sense on paper, right? And theoretically can make sense. But sometimes don't pan out when they're actually tested in people with IBD. So you've tried a lot of different things over the years, and I want to get into some details about some of those. But how do you weed out what you think is like quackery and what is actually worth trying?
Well, at the time I developed the protocols, because again, this is the downside of being healed is you can't test on yourself anymore.
Yeah.
So it's like now when I go, oh, I think that'd be good, I try to look for people who can test this for me. But at the time, my criteria was that it had to work. It had to produce the same result a minimum of 3 times under different circumstances. So I wanted to discount for, okay, well, what if it worked really well, but I was really less stressed that day, or, my psychological state was more positive, and that's why, this substance produced a positive result. Or perhaps I ate something that day and then I didn't eat that. Do you know what I'm saying? So I kind of, without being able to isolate obviously every variable, I went, well, okay, if I take the substance at 3 different times, 3 different circumstances, and it produces the same result, that gets a checkbox for me. Okay. To say, okay, let's put this in the this probably works column. And then so that's how I isolate it, because I didn't even keep track of how many things I tried. It was just because I was living abroad as well at the time. So I was in Japan for 2 years and I was in England for 3 years. And so I was trying a lot of remedies from all over Asia and then all over Europe, and then just kind of whittling it down to, well, what gives me these, fairly reliable positive results. Mm-hmm. And then putting them together, because again, we're in this like one drug, one result mindset because we've all grown up in it. Right. But holistic healing doesn't work like that. It's holistic. We need to take all these elements and put them together. Okay. And it's, so there's a lot that's accomplished through the synergy and the fact that you're supporting the body on multiple points, that I think results in the healing, or certainly makes the healing faster.
So I know your protocols are quite nuanced and personalized and adjusted based on how patients respond, but can you name like the top 3 things you think for somebody who's like newly diagnosed for IBD? And I know you have multiple protocols and multiple steps, but if you had to name like the top 3 that may be the most impressive as far as response and getting a very noticeable response and significant response.
Okay, I would say, since a lot of people with IBD have diarrhea, I would say L-glutamine on an empty stomach.
Okay. Why on an empty stomach? I've been on L-glutamine for years, then I stopped recently, and but I've been on it at various times. So why on an empty stomach?
Because if you take it on an empty stomach, it increases the absorption of the liquid from the colon. But if you take it with food, it functions more like a therapeutic amino acid. Okay. So and there's a lot of research as well on putting it into your J pouch. And I don't know why that works, but for some reason, people find it helpful, which is okay. I didn't even go there because I've never had anything. I've never had a colostomy or anything, so I can't comment on that. But I definitely know that people see results from L-glutamine on an empty stomach. Okay. And then the other big one would be the Jini's wild oregano oil protocol, which combines high-dose wild oregano, which is a broad-spectrum antipathogen, during the day, 3 to 5 times a day, and then right before bed at night, a therapeutic-grade probiotic, again, a very high dose. And that is something that I tested with a few hundred readers. And we started off going, okay, let's just kill the bad bugs, right? So we started off with just the wild oregano and looking for, well, what's the dosage that can have the most antipathogen activity, but it's not so high that it then triggers a flare or leads to some kind of intolerance. But what we quickly realized is, oh, you know what? You can't just do that continually, you have to balance it with the probiotics going in, and that calms the gut down. And of course, the probiotics are also, the potent strains and species are also antibacterial, antiviral, and the combination of the two was what seemed to produce the best results in people. So we also initially thought, wow, wild oregano is such a strong substance, we better wait till, maybe you've calmed things down, or you've been on the elemental diet for a while, and then over time we realized, no, hit it right off the bat, day one, boom, wild oregano protocol with the high dose probiotics at night. And so that then led to so many people, I guess, through word of mouth, and then saying, I don't want the Listen to Your Gut book. I mean, it's 500 pages. I don't want that. I just want the wild oregano oil protocol. And that went against, my holistic healing paradigm. I'm like, that's just one piece of it. But people asked for it over and over again. So then I pulled it out and I put it into a smaller book on, natural healing for gut infection.
Okay.
So that says, okay, well, I don't particularly agree with this, but here you go, because everybody wants it, right? And then along with that, once you, and again, as something that works against the MAP, the mycobacterium. And then at the end of it, like when you're done with the 3 to 5 times a day wild oregano, people also get really good results from doing a probiotic retention enema. So again, you can get, just a super high dosage of good bacteria into the colon, and you retain it. You just hold it in there till the liquid's absorbed. And that's something that people get good results from.
Okay, so I guess that does count as 3. So it's the L-glutamine, wild oregano oil, and the probiotics, and I believe you recommend the Natron Healthy Trinity, right?
Yeah, well, not necessarily Healthy Trinity because it's encapsulated. That's only if you're having less than 3 bowel movements a day.
Okay.
And if you're having more than that, then you got to go with the powders.
Okay. Yeah, I can just speak from the perspective of conventional medicine, is that, the traditional teaching is there's no role of probiotics for Crohn's disease, but I understand your perspective in that, and I agree that all probiotics are not the same. And sometimes what is done is they'll study a few different probiotics and then make a general statement that all probiotics don't work. But I don't discount the fact that maybe another one that's better formulated may work. I don't discount that possibility. But that's why most GIs, if you're a patient with Crohn's, if you ask about probiotics, they're going to say that, you can try it if you want to spend the money, but the experience according to the clinical trials as far as what strains were used, and I don't think anybody has studied natrins in the context of a randomized controlled trial for IBD, at least to my knowledge. So I guess it's to be seen.
Well, if you want to, I know the founder of the company, she would be totally up for that.
Okay.
Supplying you with product.
Interesting.
Pretty sure. Because she's done a number of trials. They did one on infants with her B. infantis strain. And again, there's because she's had a full-time PhD in microbiology on staff for a couple decades now. She has one of the world's largest libraries on, microbiology papers worldwide. She loves stuff like that.
Okay. Yeah, maybe we can exchange that information afterwards. So, and this is a little bit more of an interesting question, but what are some things that you find a lot of people are doing over and over again for IBD in the alternative sphere that you find is a waste of time? And that, keeping in mind that everyone's different, right? Maybe some people respond to things and others don't, but what are some of these things that come up over and over again that you feel like the majority of people that you've interacted with don't respond to?
The only thing that sticks out for me, and again, with the caveat that it does work really well for some people, would be the raw juicing.
Okay.
Because if you tend towards diarrhea and you do the raw juices, that's just gonna kill you. Most people, and again, for some people, it's wonderfully healing. But if someone came to me and they hadn't tried anything yet and they said, I'm going to do a raw juice diet, I'd be like, I wouldn't.
Yeah.
That would be the thing that I would steer people away from, just because it's likely not to work too well.
Right. Yeah, I tried that myself at one point. Years ago, I had seen a video of some guy on YouTube who had, I think, ulcerative colitis and was juicing all these different kind of vegetables and saying it helped him significantly. So I was so enthusiastic. I went to Whole Foods. I bought every green vegetable in the organic section. And I blended it all. It tasted like the water from a fish tank. It was so disgusting. And it did not work. It made me worse.
Yeah,
so
exactly.
At least that's my experience.
It's like when your digestion and absorptive capability is greatly reduced, do not put raw veggies in there, especially concentrated raw veggies.
Right.
The body just can't handle it. And that's the thing with, a lot of the flack I get from people in the alternative field, when they read my book and they're like, oh, I know you're a fraud because you're telling people to eat white rice. I'm like, this is a healing process. And like you said, you've got someone walking into your clinic who is severely malnourished and they won't eat this and they won't eat that and they won't eat that. Guess what? Yeah, you put that person on brown rice, they're not going to tolerate it because it's too much fiber. Their system is too reduced. Same thing with the elemental diet. People are like, do you know how much maltodextrin is in that thing? Yeah, I do. I used it to heal myself from 99 pounds to 135 working out at the gym 3 times a week in 7 weeks flat. Because what you need when you're in an incredibly diseased, decreased state is not what you need when you're healthy. And this is the concept that people have such a hard time getting their head around. And they'll just slam you for it, and you're like, you don't understand. No healthy person should drink Absorb Plus. The elemental diet thing, because there's too much maltodextrin. There's too much. Nobody needs that much carbs, right?
Right.
And not in the form of a glucose polymer for sure. So, but that doesn't mean that it saves so many lives from people. We had this one woman. She had end-stage AIDS, so it didn't matter what she ate, she would vomit it an hour later. So she gets on Absorb Plus. And for the first time, she starts to gain weight because it doesn't matter that she vomits. It's in her bloodstream in 20 minutes. So she's getting the nutrients. Right? And that's where people need to get their head around. This is where diet, when it becomes religious, is really destructive.
So this was actually one of my questions coming up was about the maltodextrin and because I've been on the specific carbohydrate diet for 10 years, not so 100% strict on it anymore, but pretty close. I'd say 95% stick to it. And I know you tried it. You said for a year, right? And Absorb Plus, I've actually ordered a couple times many years ago. And one of the sticking points was like, yeah, I'm on SCD. And
Elaine doesn't like maltodextrin.
Right. Yeah, and there is some data that it can lead to dysbiosis and potentially lead to adherence of like invasive E. coli strains in the gut, and they can form thicker biofilms with that. But so and you said before you use fructose, which would be okay in SCD, but people, there is a lot of people who have fructose intolerance too. So. What is the function of maltodextrin in Absorb Plus? Is that a thickener, a sweetener, or is it like a carbohydrate source?
It's a carbohydrate. Because if you don't use maltodextrin, then you're using straight monosaccharide carbohydrates. So you're basically using, dextrose or fructose. And you put in enough dextrose and fructose and galactose to make up the carbohydrate component this is when you're having it as an exclusive food source, you're going to have the sugar high from hell. Okay. And I know because I did that first. When I was developing these, when I was doing it for myself, when I was 99 pounds, I was going to the bodybuilder store because that's where they had all these things. And I was getting their carbohydrate blends, which were high on the monosaccharides. And, oh, man, talk about, just slammed like headaches and brain fog and all the rest of it. And then so maltodextrin it's not a monosaccharide, but I guess as a glucose polymer, it for some reason fits the elemental category requirements. And when I switched to that, it was such a huge difference. Okay. And if you don't use carbs, then you just take it, and people are like, why do you even have carbs in there? And we're like, well, just take a protein shake then. Like, don't buy Absorb Plus. Mm-hmm. Just go buy a protein shake. Buy your sprouted brown rice protein or your whey isolate and just take that. Now how are you doing? Guess what? You're not gaining weight. You're not, again, I tried that. I tried that when my albumin levels were completely bottomed out. You know, I'm 5'7". I weighed 99 pounds. So again, the theory is one thing, and then what actually works is another. Mm-hmm. And so, you know, sure. For people to get, and again, people say about the protein component, well, why do you have a whey isolate, right? So the casein has been removed and the lactose has been removed, but it's still whey isolate. It's not a free-form amino acid. It's right. Not a completely hydrolyzed. They're like, why don't you use that? And I say, because the body cannot build muscle unless it piggybacks on a dipeptide bond protein. So again, I tried the free-form amino acid formulas. I was not gaining any weight, and nothing was happening. And I was like, why? And I remember researching. Finally, I find this paper by a PhD nutritionist who says, to Bill, who was also active as a bodybuilder, finally pulled out the information that to build, like, free-form amino acids can't be used to build protein unless they piggyback on a dipeptide bond or higher. Otherwise, they just function, again, like we were talking about the L-glutamine, they function like a therapeutic, mm-hmm. or they function to combine with other amino acids to do certain things. So, you know, you have to understand why the ingredients are for, and why it works. And then, you know, again, if your religious dietary beliefs get in the way, fine, go try something else. Like, right. if you get it to work for yourself, if you can get a straight protein shake to work for you, do it. No mm-hmm. question. Awesome. If you can use straight protein and just some really good fat, you know, like your coconut oil, your flax oil, go for it.
And nowadays, the more recent research is, you know, we used to only use elemental formula, but now polymeric formulas are found to be equivalent in efficacy for Crohn's disease as far as, you know, inducing remission compared to elemental. So, yeah, the fact that you have some, you know, not all the protein in your Absorb Plus is elemental, I don't think it would make much of a difference. Do you still recommend Absorb Plus or polymeric or exclusive enteral nutrition to ulcerative colitis patients too? Because according to our data in, you know, conventional medicine is that it doesn't work for ulcerative colitis. So yeah. Do you have that caveat, or do you still use it in both?
No, because so what I recommend is not an elemental diet and I have to backtrack because this is like my personal bone of contention. Again, nomenclature has shifted. So when I developed this product and I came up with it, a whey isolate was considered an elemental protein shake. Okay. But then, as of course food technology evolves and blah, 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 now it's called polymeric. But I'm like resistant because I'm like, well, I'm sorry, I was here first.
Sure. Okay.
But I also have data, this is really interesting, where they did a clinical trial on people who had the current definition of an elemental, so just a free-form amino acid shake, and a polymeric shake, and similar remission rates between the two. But when they started transitioning them back into like sort of the next grade of nutrition, the ones who were on the polymeric shake maintained their remission rates, and the ones who'd been on the elemental free-form amino acid had a massive relapse. So that's another really interesting point to keep in mind. Like, just to go, like, people, again, psychologically, they think, well, we'll just go back as far as we can. and then that'll be better. Well, not necessarily, right? Because your goal is not to find a diet that you can be on and just be symptom-free as long as you drink this shake for the rest of your life. The goal is what moves the body towards healing, what moves the body to rebuild its natural systems that can and should function just fine, right? So, and now I forgot your question.
Oh, no, I think you answered it. Yeah.
Okay.
I tried elemental diet couple times. I remember I used Peptamen OS, which is probably one of these ones that you would consider has a lot of like bad ingredients in it. Tried that a couple times. I think I tried another one too, but I couldn't do it past 3 days because I was so used to eating SCD, which is, it's like fresh food, like food made from scratch. And then to transition to that, I only lasted about 3 days. I could tell it was making a difference, but after that, I just couldn't handle it. And I always wondered, do you have tips to help people stick with it for according to our trials, it's about 6 weeks you got to stick on it. Yeah. Versus, my main problem with it it felt like I was eating cake, like a birthday cake, all the time.
Now remember what your other question was. Do I recommend for colitis? Do I still recommend
right. That was
elemental
the question.
diet?
I even forgot it. Okay.
This. Thank you for reminding me because it all ties together. I don't recommend an elemental diet. I recommend my version, which is I call the IBD remission diet. And from my readers, it works just as well for colitis as it does for Crohn's. But it is not just about taking the shakes. So first of all, what you brought up about you feel like you're eating cake all the time, I call that taste fatigue. And nobody can just eat sweet, sweet, sweet. Right. You got to go sweet, salty, because that's what stimulates the taste buds. That's what stimulates satiety and appetite and all those components of nourishment. So on the IBD remission diet, you have your elemental shake, and then you have a homemade bone broth or mushroom broth or vegetable broth. And so and ideally all four. So I want people to be having beef broth, chicken broth, mushroom broth. So you get, with a lot of shiitakes, you get the beta glucans from that, and then a vegetable broth. So that's what you're having in between your shakes to help you reset so that you can have another sweet shake, because otherwise you just can't do it. It's totally, you just hit taste fatigue very quickly. We also have recipes for people to make their own homemade jello, because chewing is something you really, really miss, right? And for me, when I was on it, this may sound totally gross to someone, but when you're on the diet, it's not going to sound gross to you anymore. I would get, say my mom or my husband would have a steak, and I would say get it with the fat on it. So they would fry it up and the fat would be nice and brown. I would just chew the fat and then spit it out. Okay. Because I could chew it and I got the beef and the flavor, and it was like, oh my God, it was like a piece of heaven in the midst of this, desert. So in terms of sticking to it, I find it awful because I'm a foodie. I'm like a gourmet foodie person. So for me, I find for me to go on an elemental diet, I got to be really desperate. I got to that's what I'm like, wait till you're sick enough, then do it. Don't try to, if you're feeling good, how are you going to have the motivation to stick with that?
Right.
But I've heard from a lot of readers who are like, oh, I love it because the relief of not having to go grocery shopping and plan meals and cook. I was like, okay, that is not a part of my universe. I can't relate to that at all.
Yeah.
But again, that's where you're back to the different strokes however, here's the other thing. There was a trial released, I think it came out of Japan, and they showed that people who did a half elemental diet had almost the same remission rates as a full elemental diet. So that's cool.
I've heard about this, and I saw a dietitian give a presentation at one of the big IBD conferences recently talking about internal nutrition, and she was saying that a lot of times she'll start people on 7 days a week of the she was telling me she uses Ensure Plus and does 6 to 7 cans a day, but then from there transitioning to like 1 day a week where you can eat regular food, and then 6 days a week, and then seeing, like she said, for some of her patients, they're able to go 2 days a week where they can eat regular food, but it's like 5 days a week with enteral nutrition. And they're able to maintain that. And she also talked about a patient who transitioned from elemental to specific carbohydrate diet and was able to do that. And I know there's some pediatric gastroenterologists who are doing that as well. So that's interesting. And one of the ideas that I had is regarding tolerance. As you mentioned, some of these people who are considering enteral nutrition are really sick. Like they're in the hospital and they're facing surgery and they're not responding to steroids. And, one idea I had, nobody's really doing this right now, but putting a feeding tube in to get exclusively the nutrition just through a tube into the stomach. And those tubes can be removed. They're temporary. Like they have to stay in for 4 weeks, but after that you can remove them. And that's a way just to get it all in there, especially if you're like too sick to even think about drinking like 6 or 7 shakes a day, And
you're telling me that's not standard procedure in the hospitals?
Not in this country. I don't know if
that's standard in Canada. They don't even try to get you to drink the pharmaceutical elemental formulas. They just put in the stomach shunt. They go, nobody can drink this. Everybody,
really?
One supplies. Yeah. They just put the tube straight in the stomach because they're like, you just can't do it.
Yeah. Okay. Yeah. So I guess people are doing it then. But yeah, I mean, it seems like it's not the best thing to have a tube coming out of your stomach and have to have a procedure. But if it's going to perhaps get you feeling better as soon as possible without, the side effects of steroids, it may make sense.
Totally.
As far as the side effect profile of steroids versus the side effect profile of just putting a peg tube that's temporary, I think it's at least comparable, but probably overall maybe safer to put the tube in.
I would say so.
So do you have some more time, or I know it's kind of getting late in the evening, maybe 10 minutes more, or?
Sure.
Okay. So you were on the SCD for a year. A lot of my listeners are in the SCD community. And but I remember reading your book, years ago, and I remember reading a sentence where, you said you're a foodie and you couldn't picture being on this such a restrictive diet for like the rest of your life. I was just curious, did you get a response to it? Did you feel like it was helping, or? Well,
the SCD was one of those things that it worked brilliantly in the beginning. Okay. And I thought, okay, I'm done. This is it. This is the healing I've been looking for.
Right.
I was a convert because the results when I first went on it were just fantastic. And then I think it was about 4 months where it then started to wane. And by 6 months, I was like, but I stuck with it, right? Because the other thing too, when you're healing yourself, like there's cycles. Right. And then there's healing crises, which is well known in holistic healing circles, where the body unmasks a long-term imbalance. And then you, for temporarily, can feel sicker until you address those things that are now coming up for healing. And so I was fully aware of this and I stuck to it religiously for a year. But I think a big part of the reason it stopped working for me was because it was so stressful for me to do that diet.
Right.
Like I did not want to spend all weekend on food prep.
Right.
And I love eating out at restaurants. And I love having dinner parties and going to dinner parties. Like food is for me a big part of what constitutes freedom.
Right.
So I think for someone with a different psychology, why wouldn't it keep working? I mean, everybody with IBD should reduce their grains and for sure. And if not, eliminate them for a time. No question. If they can, again, if they're not so malnourished that they need to have like something like some white rice or something just to keep a little bit of keep the process going. But I think that I would love to see people on the SCD then go on my wild oregano oil protocol with the wild oregano combined with the high dose probiotics, because I think that's the only piece that's missing.
Okay.
In my opinion, I think if you just then transition on, and then you may say, well, yeah, I'm going to eat mostly SCD, but when you're traveling and you're in Thailand or you're in whatever, and they don't even speak your language, you try to explain zero sugar to someone in Thailand. It's not going to happen. They're going to put sugar in it. It's going to be in some sauce that's pre-prepared, or Right. So that for me is like, until you can do that, I don't count that for myself as being fully healed and as being completely free. So I think SCD is a fantastic way to get there if then we could just get the gut flora back to full health.
I totally agree with you regarding the stress. I've felt it this whole time I've been on it. And I think when I started it, I had this thought in my mind that, this is how I was going to so-called cure myself. And over the years, that didn't necessarily pan out as far as getting like full results, I think it definitely helped to a great degree, but I did need some support with additional things along with it. But there's definitely the stress. I mean, after a while, you get better on it. But I agree with you. Then you start thinking like, okay, what do I do from here? Is this how I'm going to live the rest of my life? And traveling is it's a disaster. I mean, it's doable. I mean, I still do it. But you end up just eating like omelets or exactly. Omelets or fruit plates or grilled fish with vegetables. And it's depressing. There's definitely a certain personality type who will do it like long term, like decades and decades at a time, where I personally don't think I naturally fit within that personality type. But I've stuck with it because I wanted to get through my medical training, and I was willing to do whatever it took to feel well.
Exactly.
Okay, so that's...
Well, that would be really cool then for you to do an experiment of going on the wild oregano oil protocol with the high-dose probiotics and then the probiotic retention enema, and then seeing, Right. And again, this is not fast. This is like if you have MAP, people cycle on and off that protocol for 2 years before it's eradicated. Yeah. And you'll feel it when the next generation is kind of coming to life and starting up again, you'll know. And then you go back on the protocol. And so again, this is the other thing that's different about real healing. Real healing is not like, well, you do this and then you do it for the rest of your life. It's about bringing the body back into balance, because once the body is balanced, the body is totally capable of sustaining health. It's its actual natural function. And so we use these things as and when we need them, and then we go off them. We don't use them anymore. And then if we need them, we go back on.
So I did do this is, again, probably 10 years ago. I don't know if the protocol has changed, but I do remember trying while I was an SCD with wild oregano oil, at least the way the protocol said in the book back then, along with the Natron's probiotic, and I think I did the enema too, at least once. I don't know if I did it but there was a lot of things going on at the time, and I was relatively sick, and it didn't particularly do the trick at that time for me. But I was also on other medications, and it was honestly one of the darkest times of this whole journey. But I don't know. I was trying a lot of different things. Who knows? Maybe if I tried it again, I don't know if the protocol has changed at all. But have you had people who have tried it, and nothing works for everybody, right? Even the medications we use that are FDA approved, actually the results are pretty bad as far as the long term for some of the biologics, as far as the people who sustain response. So just because one person doesn't respond doesn't mean another person will. But I did try it back then.
But see, my caveat on holistic healing is, from what I know and what I've experienced, if you're taking a potent drug at the same time, you're not going to see the results. Like, you have to, the healing protocol has to be geared to weaning you off those drugs. And then what I consider the deep root level healing of your body can begin. Because if you're taking, like, say, prednisone, for example, right? Prednisone alters the pH of the stomach and certain, I'm not sure what it does in the small intestine. I don't even know if we have that information. But I do know that prednisone and the birth control pill make it extremely difficult to implant a good flora just because of how they change the gut environment. So you can say, well, I tried it and it didn't work. It's like, yeah, but you're knocking out, you're creating a hostile environment for these probiotics. They can't adhere to the intestinal wall. They can't colonize. They can't, so it's kind of, and again, then we're back to what we talked about at the beginning, like drugs as a short-term measure, or drugs as, breaking a feedback loop, or as a crutch for a period. But, if you want to follow the protocols that I offer, you really need to get off your drugs at some point. You need to wean, like I always tell me, don't stop taking your drugs, just wean them very gradually. And again, this is part of listening to your body. Like for someone, they may be able to do a fast taper and then never touch them again. And for someone else, they may need to do their weaning taper might take 6 months or a year, or maybe they need to stay on their drugs for a year or two until psychologically they feel they can. Because if you psychologically put yourself into a fearful state, your gut is going to react instantly to that in a negative way. So then we're back into this interplay and recognizing all of the factors that interplay in a holistic model.
Yeah, I think for this is probably an area where we probably agree to disagree on the, definitely prednisone is a drug that, we want to taper as soon as possible. But I guess for the way I practice is it's more like according to each patient and the severity of their disease and their prognosis, and regarding, what maintenance therapy they may require. Now, I'm a big believer in diet and medication and doing both. And I don't have the attitude that medicine interferes with the efficacy of diet. I think using both can get, in my experience, has gotten people to have very optimal outcomes, including in my own personal case. But I respect your perspective on it, given your experience. Next, I just wanted to talk about, you mentioned MAP, right? The MAP bacteria. Did you ever get tested for MAP?
No.
Okay, because I know the testing is. I saw a blog post you had recently about a test that came out recently to look for that, but to my knowledge, there's no like FDA approved testing right now.
Yeah, and that blog post, I'm in the process of I'm going to actually rewrite it, because then that was from a doctor that I followed for a while, and I respect his work, because I don't know about lab tests for MAP. Like that's totally outside my area of knowledge or expertise. So I was just passing on that this is what he uses with his patient. And so then a lot of comments of people coming in going, that's not the right test, and this is the only test, and this is so then I pulled in a friend of mine who's a geneticist and another friend of mine who has a PhD in immunology, and I was like, help. And based on what they said, I'm like, okay, this is again a much bigger thing. Right. And can you test for just the DNA, or do you need the RNA? And my geneticist friend is like, well, the only one I trust is the one in my own lab. And I'm like, yeah, but he's like, no, that's not commercially available. And, so it turned into be this much bigger, and the immunologist, her whole point was that, just a large percentage of the population has MAP. Okay. That's not what makes it an element in disease causation. Like that's right. So then it's like, well, so you spend $1,000 or $2,000 on this test. How useful is that information anyway? Right.
Okay. Yeah. I was just curious if maybe you'd confirmed it or not, but I think most people just kind of, empirically treat for it and see if they get better. But the testing is very difficult definitely very hard to culture the bacteria. And then as far as doing other kinds of tests, nothing has yet been FDA approved. I know one of your steps to healing talks a lot about the environment, right? Like this toxic environment that we're living in. And to my knowledge, as far as what things in the environment that make IBD worse, according to conventional medicine now, mainline gastroenterology, there really is only a couple things, like smoking in Crohn's disease, taking nonsteroidal anti-inflammatory drugs for both diseases is going to make it worse. Besides that, there's some data that taking antibiotics maybe in childhood could predispose you to the disease. And even having like furry pets, growing up with furry pets can be protective for allergic conditions and IBD, potentially IBD as well. And that's kind of the extent of it. Now, there's been research about like C-sections, is that a risk, or breastfeeding, and the data is kind of controversial. I mean, I think some of the initial data said it was a risk, and some studies say it's not a risk. It's hard to say. Theoretically, it makes sense why it would be a risk. But what I'm more interested in with you is you've talked about electromagnetic radiation and the rollout of 5G, which is coming. This is something I've read about quite a bit. I've read a few books about it, and at this point, I don't know what to think about it. I've actually tried to do interventions to limit my exposure to electromagnetic radiation. In my bedroom, I've shut off like the electricity in my room through the circuit breaker, and I actually have a Faraday cage around my bed with a grounding sheet.
Does it go on the floor as well, or is it just around your bed? Okay, good.
Yeah, it goes around my bed, and I have a grounding sheet under my bed that's grounded.
Okay.
So I didn't really I just did it. I was just experimenting on myself. This is not something I recommend to anybody else or to patients or anything like that. I was just curious, just given all this stuff I've read about the physiologic effects of electromagnetic radiation, that it has effects on growth of bacteria, can open up your blood-brain barrier, can open up calcium channels in your cells. So I did it, and to be honest, I was sleeping in that bed for like a few months, and I didn't really notice anything noticeable. But, I feel generally pretty well anyway, so I don't know if maybe somebody who is sick would notice a difference. So eventually I just took it off. I don't use it anymore because it was kind of a little bit claustrophobic to sleep in that thing. But what is your opinion about electromagnetic radiation? Because, Crohn's and colitis existed before a lot of these like wireless technologies came out and became like so widespread. So is this something in your opinion that's worsening things or may potentially be worsening it?
I think that it's like any other. I do class it as a toxin, as something that puts an extra stressor on the body that the body has to deal with. They've done some, you've read widely about it already, so we won't go into that. But so my personal view of it is my home is hardwired. I don't have Wi-Fi in my home. Everything's cable. I have a corded landline. I don't use a cordless phone. I try to get my teenagers to turn off their phones when they're in their house, and sometimes they comply and sometimes they don't. But my view of it is, okay, out there, you can't control it. So, because I do know people personally, I know an MD and I know a Silicon Valley engineer. These are not people predisposed to making up electrohypersensitivity, right? They lived in San Diego. They became electrohypersensitive. He was even worse than her. He had to go into this remote mountain and live in a tent for almost 6 months because he would have these excruciating headaches. Wow. And now he's become an expert on educating other people and, different solutions. And then again, by improving their health holistically, they've got to the point where now they can live in cities, but they identify, well, where's the lowest radiation place where we can go and blah, blah, blah. So my thing is look, let's just, not just for IBD, but for everything. Why why subject ourselves to what's become the norm in terms of a toxin load? But if you look around you, everybody has something malfunctioning or will have something malfunctioning. I don't want to live like that. I actually want to be in superb, vibrant health. So my philosophy is I'll cut out everything that I can. I'll avoid it when I'm in my home so that there's a place for my body to restore and repair and sleep. And then the other thing was my daughter, when she was younger, she would get these hemorrhagic nosebleeds. And I went, wait a minute. And so I went in and I tested her classroom. I bought a radiation meter. And my son, too, he said, I need you to test mine, too, because I started getting headaches. Well, where he was sitting was right underneath the Wi-Fi modem.
Okay.
So I tested and I said, okay, there's 3 places in this room. And I talked to his teacher and I did it respectfully. I went in after hours because, again, nobody likes you to challenge the status quo. Right. So I went in after hours and I said, okay, my son needs to sit in one of these 3 places only. And he said, no problem. My son had no more problems the rest of the thing, but he was getting headaches and he was getting a little bit of nausea. My daughter was having nosebleeds because we realized, okay, not only is she getting Wi-Fi at school, she's a competitive gymnast. So the gym where she went to train had put in Wi-Fi. So now she's getting a really big load for most of her day. So then I went and I tested her classroom. I found out, okay, this is the best place for her to sit. We did a couple of other things and then she was able to keep them in check. And then her gym, because the kids were then sitting on their devices instead of training, they got rid of the Wi-Fi and she was fine after that.
Wow.
So again, there's thresholds, right? There's like, if you load it to here, you're fine. And for me, having seen people become actually electrohypersensitive, I'm like, you do not want to do that to yourself. Because you're literally like you can't even forget food freedom. You're living in a tent in the middle of nowhere. Sure. I mean, it's severe once you get tipped over your threshold.
Yeah, and I'm scared about children. Being born in this very foreign environment. Our genetics and our genetics didn't evolve to be bombarded by this electromagnetic radiation. And some of the people listening are going to think this is all quackery and, it has no effect on damaging DNA. This is non-ionizing radiation. But I'd encourage them, and it's true, the research isn't settled on this, but at least there's animal data and in vitro studies that show that it has physiological effects, and it's not the same as, not all radiation is the same. And what this does, at the very least, is it heats tissue. It works just like your microwave oven as far as, and it could make you more dehydrated, potentially. But then it has all these other physiologic effects. I think it has, they've shown an effect on sperm as well, fertility too.
Yeah.
And
sperm number and motility are hugely affected.
And people.
So then how can you say, that's such a basic marker, right?
Right.
And look at the rise in infertility.
Right.
Right. And women, where are they carrying their cell phone, right?
Exactly. Yeah.
In their bra, in their pocket. And that's the thing I try to educate my kids on. I'm like, put it in airplane. Don't carry it around. Don't, like my son, don't put it don't put it in your pants pocket. Right? Keep it away from your brain, your heart, your genitals. Those are your hot zones. Keep it away from that. I see 65-year-old guys and they've got a cell phone and they put it in their breast pocket. And I will actually tell them, I'll say, that's really dangerous for your heart. If you don't want to put it in an airplane, at least move it. At your age, at least move it to a different pocket.
Yeah. I mean, we don't know if it is a risk factor for developing maybe AFib or arrhythmias or heart attacks. But if it was me, I'd be on the safe side and not put it in my pocket right next to my heart, especially because the heart is such an electric organ.
Okay, but so I'll give you a piece of data, and I tried to go find this later, and it's gone. It's been deleted from public records. So I'm living in Singapore, and all of a sudden there's this huge news item all over the newspaper about these 21-year-olds who've been showing up in ER with heart attacks. And they were like, what is happening? They're 21, they're 22 years old. Well, the rage at the time in Singapore was to make the cell phone as small as you can. This was about 18 years ago. to make the cell phones as small as you can. So they'd made them really small, and they'd created this bling jewelry so that they hung around the kids' necks. Mm-hmm. Well, if you hang a cell phone around your neck, where is it hanging? Right next to your heart.
Yeah.
And they're showing up in ER with heart. So I was like, after I became more educated about, I remembered this happening from when we were living there. So I went online to try and find it. Nothing. There's no, and I don't know if that's, because people weren't on, the internet wasn't as prolific at that time, or if it's, industry, we're back to like when someone's making billions of dollars from something, there's a lot invested in suppressing information and knowledge. Mm-hmm. So that's where we go. I don't get stressed out. I don't get neurotic about anything. I just go, okay, let's get rid of that. Let's minimize that. Right. Let's just support my body so that it doesn't have to work so hard to be healthy. Yeah. Right? Like.
Yeah, there's this documentary on Netflix called Afflicted. Have you heard of this?
No, I haven't.
I watched that, and that really had a profound effect on me as far as, I was one of these people who would really try to control all aspects of my environment and try to minimize the toxicities around. And, it seemed like every week I was reading about some other thing in my environment that was potentially making me sick. And this movie follows about like 4 people, and you can see how being like overly neurotic about these things can really make you go down a rabbit hole and get into a really dark place. Like they had one woman on there who felt like she was sensitive to like mycotoxins or like fungal things in the environment, and she ended up living in a van in the middle of the desert, like completely isolated. That was one case, and there was another person similarly. I think there was a sensitivity to mycotoxins, and ended up completely demolishing her house in order to like rebuild it. And so I think you can go to the extreme if there are reasonable interventions that may make sense. I myself do those types of things. But one of the things I wanted to ask you about was this cookware. I watched your video, and you said if you have pans that say that have a T on it, or what is it, Teflon?
The Tefal or Teflon.
Yeah, I have Tefal pans. So what is should I get rid of those, or what's the best thing?
Well, yeah, there was a huge thing, because what happened is people's birds were dying, and they were like, why is my bird? He just suddenly dropped dead. And I don't know who made the connection, but it's because when they're cooking with their Tefal pans and they heat past a certain temperature, the fumes that are actually kill their birds. That's the toxic level that's coming off those. And so then you go, if it's coming off into the air at a sufficient, strength to kill a bird, what's going into your food?
Sure.
Yeah. You're then eating. So that's when I was like, oh, wow, that's just crazy. So got rid of all of that. And you know what? The Le Creuset ceramic coated cast iron are so worth the money.
Okay.
They really are. I resisted for a long time because they were so crazy expensive, and I tried buying cheaper versions, but they are worth every penny.
So they're cast iron but have the ceramic.
Yeah, ceramic enamel, which is completely inert. People have been cooking and eating off ceramic enamel for hundreds of years.
Okay.
Yeah, that's your best one. And if not, then go with a stainless steel, but make sure it doesn't have nickel or aluminum in it.
Okay. I do have some stainless steel. They're really a pain in the ass to clean, though. That's the problem. But okay.
And also, when you're used to using Tefal, you forget how food normally behaves.
Right.
So you're used to having, that just comes right off. And then you learn. So for anyone who's transitioning to that, for your stainless steel and your cast iron, the cardinal rule is not, if you've got a hot pan, only put hot water in it. Do not put it into cold water or run cold water, because that's what makes your pan then stick to everything.
Oh, okay.
Yeah, there's a tempering process that you need to follow, and then you need to preserve it. And so as long as you either wait till your pan cools down to wash it, or what I do is I get my water going really hot, and then I wash it while the pan is hot, so then everything comes off really easy, but I haven't mucked up my surface for the next time I cook.
Okay. Interesting. So, yeah, I think I'm probably going to invest in some new cookware. But you know what? I know we've covered a lot of ground. I don't want to take any more of your time. We've nearly gone 2 hours, but I think we've definitely made some great points and talked about a lot of the topics people want to hear about. Is there a website that people can find your information, and if they want more information about your book and your blog and things like that?
Yeah, everything's on listentoyourgut.com. And
Okay.
the blog, just type stuff into the search box, right? Type in, if you want to know about maltodextrin and the Crohn's biofilm, just type in biofilm, it'll pull it up. If you want to know about stricture heal, type that in, it'll pull up the posts with the experimental protocols there. Like everything's on that blog. Or I have a section called Heal Your Symptoms. And that's where stuff that we have tried and tested with myself, my family, my readers, and that we know works well it's a little drop down menu. So whether you've got like the vomiting flu or you've got acne or whatever, if we've got stuff that works, it's there.
Okay. Great. Thanks again for your time. And, maybe we can do this again sometime in the future.
Sure. No problem. Anytime.
Okay. Thank you.